Hey everyone, it's Dr. Alessandro. Welcome back to my channel. And in this video, I'm going to be talking with you about a question that I get from some patients. And that question is, hey doc, do I really need to come twice a year? So that's kind of a loaded question, and I'll kind of approach it maybe in a different manner. So if you need to come twice a year is almost more of an insurance question. A lot of insurance companies, and I mentioned insurance companies in the past, offer benefits which allow you to go to a dentist twice a year to have a checkup, a cleaning, and once a year x-rays. And so then they cover that either almost in full or in full, which is a good benefit. But that doesn't necessarily mean you absolutely need to come twice a year. So some people really need to come more frequently than that. So people that have gum disease, especially more advanced gum disease or aggressive gum disease, should actually be seen 3 or maybe even 4 times a year. That's because we want to keep the gum disease under control. Gum disease is something that can cause significant problems. Of course, it can cause loss of teeth, but the bacteria that cause gum disease, periodontitis, has actually shown up in heart problems. And so there's been a link associated between these bacteria, the microbes that are in gum disease, and heart troubles. So that said, it'd probably be best to keep, if you have gum disease, to keep that under control and visit the dentist either 3 or 4 times a year, depending on the severity and the level of control that you're at. So those people should go more frequently. People that should go twice a year is maybe, I'm not saying everybody, but a fair number of people. That is, folks who maybe brush a couple times a day, but maybe not the best in the world at flossing. It's good to at least stay on top of things, with routine checkups. So, a lot of people could benefit from 2 visits a year. Now, there are some people who, if they have great home care, that is, if they have, they brush 3 times a day, they floss every single day, some of those people may actually be okay with once a year. And so it all really does depend on the person, their habits, and also how frequently they've gotten decay or cavities or gum disease. So if somebody has frequent cavities, maybe they should go twice a year, and maybe they should have x-rays every year, because we want to stay on top of that. We don't want to let cavities run wild and then end up with big problems, big bills, and then that really doesn't make you happy, our patients. We want to make sure we keep everything under good control, and that way people stay healthier. So like I said, there isn't really a straight answer to, doc, should I come twice a year? It all really depends on you and your habits. So if you have really good habits and a low incidence of decay, maybe once a year is for you. If you don't have quite so great habits, maybe keep up with the twice a year habit, twice a year visits. And if you have, like I said, gum disease and you should be keeping it under better control, then 3 or 4 times a year could be best suited for you. So that said, I appreciate you watching. Thank you so much for doing so. Thank you so much for being a part of my channel. And if you have any comments or questions, please feel free to ask. And like and subscribe, and hope you're all staying well and healthy.